Hello everyone, my name is Vihaan Gehlaut and I will be presenting on dengue fever, fighting the bite. To start, I'd like to share some things about myself. I'm a rising junior at the International Academy East in Troy, Michigan. Outside of academics, I enjoy playing tennis, practicing piano, and planning and leading events through my school student council. Furthermore, I'm the secretary of the teen advisory board at the library and serve as the vice president of the chess club at our school. I find joy in the various aspects of medicine and I aim to be a physician in the future. Global health, as we all know, cultivates an opportunity of better healthcare for all. Yet when illnesses and problems are discussed, they tend to exclude certain voices. Such is the case for dengue fever. In Africa, where the majority of dengue cases lie, many residents are unaware of how to battle the disease entirely, and I aimed to help those people. But before I tell you about the initiative I took, I will be sharing details about this global health issue. Today, my aim is to not only illustrate how detrimental dengue is in a global context, but to also display through the work I've done how all of us should play our part in combating it. Dengue fever is a vector-borne viral disease caused by the bite of an infective female Aedes mosquito. There are 4 dengue viruses, DNV1, 2, 3, and 4, all of which belong to the Flaviviridae genus, alongside deadly diseases such as yellow fever and Zika virus. Due to their distinction, contracting one of the dengue viruses only ensures immunity for that specific type, meaning that a single person can have dengue up to 4 times in their lifetime, with increasing severity. Dengue is commonly regarded as break-bone fever due to the extreme levels of bodily pain that is common in many cases. The Aedes mosquito is an invasive species and is common in tropical and temperate climates. While dengue is not contagious, the increasing global presence of the Aedes is leading to record infection rates across the world. The impacts of dengue lie in the symptoms that it causes. Typically, someone with the illness will develop mild or no symptoms, consisting of flu-like fever, swollen glands, and the infamous pain behind the eyes. However, for the 5 to 10% who do develop dengue hemorrhagic fever, it can result in severe pain, bleeding, and potential septic shock or multi-organ failure. As there is no existing dengue treatment and no widely accepted vaccine, acetaminophen in over-the-counter drugs such as Tylenol is the main medicine, with supplementation of blood transfusions and intravenous fluids in severe cases. However, other OTC drugs such as ibuprofen and aspirin can have extreme negative effects on a dengue patient. Now let's look at the global effects of the disease. With the rise of international travel and the warming of global temperatures due to climate change, the Aedes mosquito is becoming both more common and comfortable in conditions across the globe, including a surge of dengue cases in the Americas. Already having been considered the most common arboviral disease, dengue in 2023 has seen an increase in cases of over 230%. Despite only being halfway through 2024, the CDC has already announced this year as harboring the most infections of any calendar year, and has issued a critical official health advisory, highlighting the global growing danger of dengue. After learning about this, I began conducting my own research on dengue in Nigeria, and compiled it into a one-pager displayed here on the left-hand side. It was meant to educate and share with the citizens of Bauchi State, Nigeria, who are affected by the disease but possess little knowledge on how to combat its detrimental effects. It was put up in the community as a source of information. However, through my research, I noticed that in such places with endemic dengue fever, the issue lies not in a lack of materials for vector, meaning mosquito, control, but in a lack of community knowledge regarding it. The one-pager revealed that the feasible, effective way to battle cholera is in fact through education about preventative measures. For confirmation, I created a survey for the community. When I discussed with Nigerian residents, they highlighted that despite people being aware of why dengue was caused, they were highly unaware of mosquito repulsion methods. Further inquiries in my survey affirmed this lack of knowledge, as shown in this question, by the majority of respondents that did not understand ways of avoiding dengue contraction. To address this outlying issue, I created a community workshop that would inform participants on how to fight this global health issue. With the title Defeating Dengue Fever Workshop, the project was designed to educate adults of the Kandahar community in Nigeria on how they could effectively eliminate the threat of dengue in their individual households by preventing it from occurring at all. The workshop consisted of several different activities that all focused on different aspects of prevention. The first consisted of group discussions, the second activity was taught through a collective trivia game, and the final activity involved the creation of DIY mosquito repellents made of natural oils that emphasize the importance of preventing mosquito bites, 80s or not. Furthermore, I created a take-home infographic for participants to further their knowledge to others. The workshop was implemented in Nigeria itself, with citizens being thoroughly educated and informed about preventative measures as a result. Although my workshop is effective in combating dengue, I hope that this is only the first step in our aim of educating others about and using preventative measures to battle this illness. We all have a role to play in this process, but whether you live in a dengue-prone area or one with a lesser threat, preventative measures are crucial for our safety. Through mosquito repellent plants such as lemongrass or lavender, avoidance of any standing water that acts as a breeding ground for mosquitoes, and wearing loose clothing in mosquito-susceptible areas, we can fight the ever-rising health concern of dengue fever. Make sure to advise such preventative measures in more endemic areas if you can, in order to help spread the word. Contending with this global issue can only be done together. Make sure to remember, all in all, the best way to combat the spread of dengue is through measures of vector control. Keep this in mind as you move forward and always stay safe. These are my references. I'd like to give a sincere thank you to the Global Health Leadership Conference program at Johns Hopkins University for providing this wonderful opportunity. The Leadership Initiative's public health program, including Marshall Bailey, Alex Levy, and Umar Muhammad, and the entire staff for guiding me through and providing a base for my work, my family for everything, and the audience for listening through this presentation and learning how to battle dengue fever and the global dangers that it poses. Thank you.